Welcome to the podcast. We call it the Brand Central Podcast. It's a lively discussion about brand management, media exposure, and your philosophy on these items. But right now, a lot of folks are focused on COVID and its disproportionate effect on the African-American community. And we have the perfect guest to talk about this and our favorite subjects. Jamahal Boyd is the CEO of the Crossroads Center in Cincinnati, Ohio. He brings more than 20 years of experience as a progressive professional in the healthcare industry. He joins us this morning. Jamahal, what a pleasure to see you, my friend.
Good morning, and thank you for having me on your podcast here, Mark. Great
Absolutely.
To see you.
Yes, indeed. Well, let's get right into it. Let's talk a little bit about some of the statistics that came out in the last couple of days, just saying how disproportionately the African-American community is being affected. I know at the Crossroads Center, this kind of stumbles right into your purview.
Yes, absolutely. So the Crossroads Center, first of all, is a mental health, behavioral health, addiction treatment services center. So during this whole pandemic and time, we're what you call an OTP, an opioid treatment provider. And as such, we are unable to close. We couldn't shut down, and we continue to treat our patients and clients during this very tumultuous time, both on an outpatient basis as well as through our residential programs that we offer. And delivering that service with excellence has been our motto during this entire time. But as it relates to the communities that we touch there, as we already know, with addiction treatment and opioid response, there's a disproportionate impact on the African American and the marginalized community already. COVID only compounded that as it related to resources, distribution of services, and where the funding and or service provision, particularly in our industry, is disproportionate to the immediate need of the hospitals and health systems and how they view and or treat mental, behavioral health, and addiction services. We are not viewed as equitable in terms of all of that as an industry. But then as you start to pull back the onion, when you look at what's happening for African Americans, when you look at what's happening with underrepresented populations, we continue to fall down further on that totem pole. So yes, it falls right in our purview, right in our lap. And one of the other interesting things as you look at this COVID crisis, the things that we do have heightened because now you have stay-at-home orders and you have people losing their jobs and you have individuals being laid off and don't know where their next paycheck or meal is going to come from. So now these are triggers to trauma is what I call them. And those triggers lead to the abusive behavior or the addictive behavior or the abuse that leads to them needing to go into treatment and seek out care. So, I mean, my plate has been full, but it's been overrunning full since the advent of the COVID crisis.
Yeah. So tell us a little bit about some of the struggles you're facing with having to continue to provide those services because it's tough to social distance for those residential treatment facilities. What have been some of the challenges and are resources for your organization an issue right now?
Well, I'll start with, where we started. And as this was starting to become an issue, it was ironic because our agency was at the point of revamping our inclement weather disaster planning policy. So we were already in front of this before it even became as big of an issue of what it was, to our credit, not, patting ourselves on the back, but that's leadership. When you look at where crisis hit, I think it tests and challenges where your policies are effective and your leadership is effective. So, fortunate to say for us, we were already somewhat ahead of this and only changed or modified a few things to make sure that we were responsive for COVID. So our inclement weather, our disaster planning policy is what became our COVID response plan, if you will. And, as we looked at where our gaps were around, well, what does this mean in terms of all of our operation, how we function as an agency in terms of leadership, our providers, our clinicians, who needs to be on site, who needs to work off site, how effective they can be in either of those places but still maintain the operations because we can't close? What does that look like in terms of foot traffic and volume? I have a methadone clinic that we operate, that we see over 500 clients a day in person. So how we shifted our focus there to minimize the foot traffic so that we minimize the potential spread, and or how do we allow certain patients that come into that clinic to take home dosing if they're eligible, so that then they don't have to come in and then manage the rest on site from a structured schedule. Reducing that by 60% was a challenge, so then managing the financial impact of that and our census. And then with our residential program, making sure that everyone was following certain protocol to make sure that we didn't have anybody compromised in our setting, while taking new people in, making sure that we're testing them and make sure they don't bring anything into our setting, and then managing protocols for our patients, those who serve our patients that are going home every day and coming back every day. So, putting a lot of policy and process in place were some of the challenges. Then making sure that we had funding to cover it. We were fortunate to put in an application for the payroll protection program to help us with our payroll expenses during this time. So that I didn't have to lay off or furlough anybody. We were blessed to make sure that our agency was whole when, some of my peers and colleagues had to reduce their staffing by 30% or more. It's things like that we are blessed at the Crossroads Center to be able to maintain, but those were challenges that we had to overcome that we weren't sure if we were going to get approved for the loan. Right. My commitment as the CEO is that, again, our operations, even though we shifted things, our services never changed. Our programs never got minimized or reduced. But the things that we needed were funding. The things that we needed were PPE, because if I'm holding my team members accountable to, having their temperatures checked every day when they come in, wearing masks when they're interacting within the social distancing guidelines, that you have hand sanitizer, Lysol, and antibacterial wipes, which are hard to come by. These are all of the challenges that, again, if we're going to be committed, we need these things to fulfill the commitment. Right. And being able to overcome some of those challenges, our local mental health board, who is one of our funders, were able to help us secure some of that, but we still have a need. So I put that out there in terms of being one that wants to help and contribute. But, we just recently experienced a $300 million cut to Medicaid, which is a large portion of what funds our expanded services. We've expanded to telehealth so that we can accommodate the people remotely versus having to come on site. But with these cuts, we don't know what impact that's going to have on our ability to serve. Right. So it's a lot.
I see. Your plate is definitely full. You weren't kidding there. Now, tell me a little bit about still maintaining that high quality, that high level of excellence you talked about when it comes to providing these services versus protecting the brand. I mean, does all the brand protection go out the window and it's just, look, we got to do what we got to do to survive this? But, at the same time, your reputation is really kind of all we got.
Right. No, so I mean, excellent question, man, and it's a personal. I have this triangle diagram that we live by in my agency. It's personal, professional, and mission at the bottom of that triangle, and all of it is what helps us to balance what we do for the mission, which is the foundation. And when we compromise that mission component of it, we're a little too much on one or the other side. So in terms of, the brand is based off of the mission, and the brand is something that is set that drives every decision that you make. And, every decision that you make is not going to be pleasing to people, and I say this to leaders all the time. We're not here to be liked. We're here to lead. And we lead by the character and integrity, not just of our own character and integrity, but of the character and integrity of the mission. And when you fulfill that, every decision that you make, you made the right decision. Wow. Because, it doesn't compromise the brand. Crises aren't new, and like we used to say when I was coming up, and I'll say it, in our neighborhood jargon, crises ain't nothing, because we've been there before. And what that personal side of that for me is is, you know, I grew up in the projects, humble beginnings, single parent, all of those things that culminate into my leadership style that I bring into and blend that with the professional to support the mission that I serve. So with that, you know, again, knowing how to resource during tough times is not anything that's not being applied right now.
Right.
You know, maintaining the standard of integrity and character and consistency says that, you know what, next year, this time, Lord willing, if I'm here to see it, when I look back at this, I know that unequivocally my character, my integrity, my brand was just as the same as it was when we didn't have a crisis.
Yeah.
You know, and that is so important because, you know, just like I say about working at home, you know, it should not matter that you're working at home, that you go from a corporate or business professional attire to sweats and t-shirts, you know, every day because you're doing Zoom versus sitting in a boardroom. And again, your brand is your brand, you know, and how consistent that is, it shouldn't matter where you are, i.e. in a crisis or, you know, celebrating, you know, a good year financially. It shouldn't compromise your brand, or your brand shouldn't change. You know, I'm Jamal, whether I'm in church or whether I'm in the community or I'm in Kroger, you know, and that's the thing I think people have been challenged with during this time, Mark, you know, so I mean, for me, your brand is everything. And for me, I've said this from when I was in college, you know, I am my brand. My job doesn't determine my brand. You know, my health situation doesn't determine my brand. My brand, I am my brand. So everything that I do is my business card to sell the services that I promote.
All right. That's a great point. I'm glad you made it. Now, for the up and coming Jamahal Boyd, the next young man in Metro Cincinnati or Metro Atlanta, what is one piece of advice, kind of piggybacking on understanding that you are the brand, be that piece of advice that you give?
Sure. You know, one of the things, well, there's a couple things I think that are important to that. One, have a spiritual centering. Because that spiritual centering and your connection to God, your relationship, your walk with God will drive everything that you do if you have that. And most of us don't focus on that, you know, as men, as Black men, as individuals, because we don't find God until we need God. And, you know, I would have most likely made different decisions if somebody would have said what I just said to me back then. But as a result of that, I will also say that where you are or where you land is a culmination of everything that you do prior to. And by that, I mean, every decision that you make now will have an impact on your future. So you need to make wise decisions, make wise choices. Think about the fact that God wastes nothing. So every experience that I've had in my past has led me to be effective in the role that I'm in right now. And every decision that I make now will have an impact on my future. So nothing is discarded. You know, the job that I had when I was sweeping up Center City, Philadelphia as, you know, a 16-year-old working my first job that humiliated me when the girls that I thought were cute were watching me sweep up downtown, but I was getting a paycheck from it, you know, and learning how, you know, to process that led to who I am today. You know, and all of those different things where I had to walk around with holes in my shoes and how that made me feel emotionally, you know, that plays into the fact that now, you know, when I see that sharp pair of shoes and I can afford to buy them, I'm going to buy them because I remember that time that I didn't have that experience. And again, I say all that to say every decision, every experience plays into your outcome and who you evolve into over time. So, you know, be very mindful of, you know, what you do, how you do it, because when you become who you are, this is going to either help you or hinder you from moving forward.
Absolutely, absolutely. Jamahal Boyd, ladies and gentlemen, CEO of the Crossroads Center in Cincinnati, Ohio, joining us on the Brand Central podcast today. Jamahal, my friend, what a pleasure. Thanks so much for sharing with us. This has been absolutely phenomenal. Tons of nuggets here. and my sincerest appreciation, my friend. You have been the paragon of professionalism since I've known you, and I'm probably your biggest fan.
Oh,
So
no,
I
sir, man.
appreciate you joining me.
That's definitely mutual. You know that.
All right, Jamahal, I'll let you get back to work, my friend. Thanks so much for joining us.
Oh, no, thank you. Thanks for having me, and God bless you all.